In this video, we will look at the normal anatomy and physiology of the heart. We will begin with the basic anatomy of the heart. The base of the heart is at the top, and this is where we find the great veins and arteries. The apex is the pointed tip of the heart at the bottom. The apex is tipped slightly to the left. The heart is surrounded by a pericardial sac and sits between the two pleural cavities in the mediastinum. The pericardium represents a double lining of membranes within the pericardial cavity. You can envision the pericardium by imagining you have a deflated balloon or a deflated ball, and then you punch your fist into it. Your fist represents the heart, and the deflated ball or balloon represents the pericardium, the two layers of the pericardium surrounding the heart. The pericardium consists of two layers, the parietal and the visceral pericardium. The parietal pericardium is the outer layer. This also forms the inner layer of what's called the pericardial sac. This is a tough, fibrous bag that surrounds the entire structure, and I'll mention this again in just a moment. The visceral pericardium is the inner layer. This is also called the epicardium. The visceral pericardium is actually attached very tightly to the surface of the heart. Between these two layers is the pericardial cavity. This is filled with a small amount of pericardial fluid. This fluid allows the membranes to glide over each other when the heart is contracting. Then around this entire structure is the pericardial sac, and this picture illustrates it. Here's this tough, fibrous sac, and then this layer here, this is your parietal pericardium, and in here is your visceral pericardium, and the gap between the two is the pericardial space. On the surface of the heart, you will note many sulci, or grooves. One set of these are the coronary salsas. These form the border between the atria and the ventricles. There's also the anterior and posterior interventricular sulci. These separate the left and the right ventricles. The function of these sulci, this is where you find the blood vessels that feed the cardiac muscles. Oftentimes, these sulci are filled in with adipose tissue. Here is the coronary sulcus, and here is the anterior interventricular sulcus. This picture illustrates the posterior interventricular sulcus. The wall of the heart consists of three layers. The outer layer is the epicardium, also known as the visceral pericardium. We just mentioned this in reference to the pericardium. This is the layer that covers the surface of the heart. The myocardium is the middle layer. This is the thick muscular wall of the heart, made up of concentric layers of cardiac muscle tissue. The innermost layer is the endocardium. This consists of a simple squamous epithelial layer over areolar connective tissue. So again, here is the endocardium, the myocardium, and the epicardium. Here's the pericardial cavity, and this layer out here is the parietal pericardium. When you look inside the heart, you see that it is divided into four chambers. The right atrium collects blood from the systemic circuit. The right ventricle pumps blood to the pulmonary circuit. The left atrium collects blood from the pulmonary circuit, and the left ventricle pumps blood to the systemic circuit. We will look at each of these chambers in a little more detail. The right atrium receives blood from the systemic circuit via several sources. The first source is the superior vena cava. This receives blood from the head, the neck, the upper limbs, and the chest. The second source is the inferior vena cava. This receives blood from the trunk, the viscera, and the lower limbs. The third source is the coronary sinus. Here, the cardiac veins will return blood to the coronary sinus, and then the coronary sinus opens into the right atrium. Also in the right atrium, you will find the fossa ovalis. This is a shallow depression that in the fetus was known as the foramen ovale. The function of the foramen ovale in the fetus was to shunt blood from the right atrium to the left atrium to bypass developing lungs. The right ventricle receives blood from the right atrium. It then pumps this blood out of the heart to the pulmonary trunk. Blood then goes to the lungs to become oxygenated. Also in the right ventricle, you will see Chordae Tendineae and papillary muscles. We will talk more about these in just a moment. Blood from the lung then gathers into the left and right pulmonary veins. The pulmonary veins then deliver this blood to the left atrium. The left ventricle receives blood from the left atrium. It holds the same volume as the right ventricle. However, the muscle of the left ventricle is larger, thicker, and much more powerful. The left ventricle controls the systemic circulation. Blood leaves the left ventricle and goes into the ascending aorta. The ascending aorta then turns and becomes the aortic arch and eventually the descending aorta. Between each of the chambers and between the ventricles and the great vessels, you will find two pair of one-way valves. These valves function to prevent the backflow of blood during contraction. One set of valves are known as the AV valves, the left and the right. These are found between the atria and the ventricles. The other set of valves are called the semilunar valves, the left and the right. They are found between the ventricles and the exiting vessels. The AV valves connect the right atrium to the right ventricle and the left atrium to the left ventricle. They are formed of fibrous flaps. The left AV valve is also known as the bicuspid valve or the mitral valve. It is called a bicuspid valve because it consists of two flaps. The right AV valve is known as the tricuspid valve. This consists of three flaps. These valves allow blood to flow in one direction from the atria to the ventricles, and they help to prevent regurgitation or backflow. Blood pressure will close the valve cusp during ventricular contraction. The Chordae Tendineae are also known as the heartstrings. They attach the AV valves to the papillary muscles of the ventricle. The papillary muscles, when they contract, they tense and pull on the Chordae Tendineae. This will prevent the valves from opening backwards and also prevent the valves from swinging into the atria. We can see them here. This is the papillary muscles attached to the Chordae Tendineae and then to the valves. The semilunar valves consist of the pulmonary semilunar valve and the aortic semilunar valve. The pulmonary semilunar valve connects the right ventricle to the pulmonary trunk. The aortic semilunar valve connects the left ventricle to the aorta. They also prevent backflow from the pulmonary trunk and the aorta back into the ventricles. Unlike the AV valves, the semilunar valves have no muscular support. Both have three cuffs, so they are known as tricuspid valves, and these cuffs support them like a tripod. Both valves of each type open and close at the same time, as is illustrated in these pictures. Picture A shows that the AV valves are both open while the semilunar valves are both closed. And the opposite is so in picture B. Now the AV valves are closed while the semilunar valves are open. This opening and closing of the valves creates the heart sounds. The lub, or the first heart sound, is the closing of the AV valves. The dub, or the second heart sound, is the closing of the semilunar valves. Blood flow through the heart is something that you need to know forwards and backwards and inside out. This should come very easily and very quickly to you. Everything begins with the right atrium. And remember, the right atrium is receiving blood from three sources. From the right atrium, blood flows through the right AV valve into the right ventricle, through the pulmonary semilunar valve and into the pulmonary trunk. The blood from here goes to the lungs to become oxygenated. It then collects into the pulmonary veins that deliver the blood to the left atrium. From the left atrium, it goes through the left AV valve to the left ventricle, through the aortic semilunar valve, and out to the body. The muscle of the heart wall needs its own circulatory system. This is known as the coronary circulation. It is made up of the coronary arteries and the cardiac veins. The function of the coronary circulation is to supply blood to the muscle tissue of the heart. The two main coronary arteries are the left and the right. They originate at the base of the ascending aorta at the aortic sinus. Blood pressure here is the highest of all the entire systemic circuit. Elastic rebound will force blood through the coronary arteries between ventricular contractions. Blood flow through the coronary artery actually peaks when the ventricles relax. This is different from typical systemic circulation. The cardiac veins consist of the great, the middle, and the small. They empty blood into the coronary sinus, which then deposits the blood into the right atrium. Next, we'll look at the conducting system. This is a series of cells and pathways that conduct the electrical impulse over the surface of the heart that will then result in the heart contracting. This conducting system consists of the SA node, which is found in the wall of the right atrium. There's also the AV node, or the atrioventricular node. This is found in the junction between the atria and the ventricles. There are also conducting cells found throughout the myocardium. They interconnect the SA node and the AV nodes and help to distribute the stimulus through the myocardium. In the atrium, these conducting cells are called the internodal pathway. In the ventricles, they are the AV bundle to the bundle branches. We will look at these structures in a little bit more detail, beginning with the SA node. The SA node is found in the posterior wall of the right atrium. This is known as the pacemaker of the heart because it contains special pacemaker cells that set the heart rate. These are set to deliver an impulse on average of 80 to 100 times per minute. They are connected to the AV node by the internodal pathways. Atrial activation begins at the SA node. The impulse then travels to the AV node, which is found in the floor of the right atrium. This receives the impulses from the SA node. When the impulse arrives at the AV node, it will be delayed slightly. This allows the atria to contract before the ventricles and also ensure that the atria empty completely before the ventricles begin to contract. At this point now, atrial contraction will begin. The impulse then travels to the AV bundle, which is found in the anterior portion of the interventricular septum. This then carries the impulse to the left and right bundle branches and onto the Purkinje fibers. They also carry the impulse to the moderator band that will transfer the impulse to the papillary muscles. The Purkinje fibers help to distribute the impulse over the surface of the ventricle. At this point now, atrial contraction is completed and ventricular contraction can begin. We will end by looking at some basic vocabulary that describes some abnormal heart rates. The first is bradycardia. This refers to an abnormally slow heart rate. Tachycardia refers to an abnormally fast heart rate. Some people also develop ectopic pacemakers. These are abnormal clumps of cells other than the SA node. They have the ability to generate a high rate of action potentials. They also can bypass the normal conducting system, ending up disrupting normal ventricular contractions.